to hear this afternoon, and we'll have opened a public hearing on Senate Bill 432. Thank you, everyone. And Mr. Dietz, could you provide an overview of this bill?
Yes. Senator Patterson, Senator Hayden, members of the committee. Senate Bill 432 requires the Oregon Health Authority to develop a program to increase consumer involvement in decisions about behavioral health services, requires the Health Authority to enter contracts with peer-run organizations, and to provide technical and financial support for activities that promote consumer engagement. It requires the authority to establish rules for peer-run organizations that receive funding, and it requires peer-run organizations that contract with the Health Authority to submit annual reports. The measure would appropriate funds, and I'll note that there is a proposed -1 amendment submitted, I believe, by the Vice Chair's office that defines Consumer Support Technical Assistance Center, and it removes the specific requirement for consumer participation on local public safety advisory subcommittees.
Thank you so much, and welcome, Senator Hayden, for bringing this bill.
Thank you, Chair Patterson. My name is Cedric Hayden. I'm a state senator for Senate District 6. Appreciate the opportunity to discuss this subject. Over the years that I've had the opportunity to serve in health policy roles here in the state capitol, we've done several bills, including a peer respite bill that folks may remember, House Bill 2980, where we directed the Oregon Health Authority to put $6 million into this pilot project to set up peer respites where we have advocates and peer-led involvement with the process. It is my feeling, my opinion, won't lay this on anybody else, but that really hasn't been followed through to the expectations. And so this is another directive from those of us that are working with the advocacy to make sure that folks that are actually have experience with some of the mental and behavioral health concerns have a voice at the table. That's really all we're trying to do here. And sometimes I believe that it takes a reminding from the state legislature to the Oregon Health Authority that we are serious about this. And so we do have a different director. We do have a new assembly here in this session. And so we are bringing this concept back with the advocacy groups. And Mr. Fitz is here to testify in more detail to you. But I really feel that this is very important. I feel that the peer respite concept that we all passed the House unanimously. I think there were 3 no's back there on the Senate side, but very, very strong support. An example is in Lane County, where I come from with Cahoots and involving counselor type approach with the public safety officers so that these people don't end up in county jail, which takes time, efforts, and really honestly an inappropriate place for them. And so to me, this is a pushback on the lack of action that we have seen, and I really hopefully that we at the legislature take these issues seriously and keep the pressure on. Thank you, Madam Chair.
Could I ask a question? It's my understanding that the funding that was made available for some of the models like Cahoots were made available as grants to counties, and not all counties availed themselves of that. I was wondering if you have any information about that.
You know, I can't get very specific on that, but my understanding is a little different, that there was a decision on funding available and how the budget cuts came out with that $6 million and the accessibility to it. You know, from folks I've talked with, that it, in their opinion, it really wasn't made available to what we thought the bill would do. So I'm not sure it's a matter of money. It's more of an access to the money issue.
Yeah, thank you. Thank you. Welcome.
Very good. For the record, my name is Kevin Fitz. I'm a volunteer with a nonprofit organization called the Oregon Mental Health Consumer Association. Just a little background about myself. I'm an Oregon Health Plan member, received behavioral health services and primary care services from CARE Oregon. I want to say Senate Bill 432 plus the -1 amendment. This actually is not a new piece of government. Governor Kitzhaber started this when we expanded behavioral health into Medicaid managed care. He set this project out in 1997, proffered an RFP on the ground in 1998. This project went on for 6 years and then ultimately, unfortunately, under the Kulongoski administration was cut due to budget cuts. The initiative that Governor Kitzhaber got from this was from the National Federal Mental Health Services arm called the Center for Mental Health Services has been funding technical assistance consumer-run centers since 1992. And there's currently 3 of those and 2 extra ones that are led by family concerns and family initiatives. This project has merit. This project has veracity. We've done this before in Oregon. Simply what this is organized as a community-based project led by individuals who are previous or current consumers of the Oregon Health Plan to do 3 things particularly. One is to educate the 250,000 people who are on the Oregon Health Plan what it means to be a Medicaid recipient, what a CCO is, what are your rights under the law, what happens if you can't get a QMHP and psychiatrist, how do you advocate for yourself? I don't know if you've seen the organizing chart of what our systems and where care coordination comes from. It's very difficult to navigate without a guide. Secondly, around the issue of consumer involvement and policy, you may remember, some of you may remember, 4 years ago, right before Representative Greenlick passed away, one of the things he was asking was the governor's office and the Oregon Health Authority, how many boards, councils, committees, work groups, and task force under your behavioral health department do you have? Last count before COVID, there was 43. Currently, we have about 60 of those. There is a state law that says every single behavioral health council, work group, and task force has to include 20% of what is considered defined as a consumer. The question that we have, and as a consumer, and one thing I think my greatest gift is my Rolodex. I know an awful lot of serious people who believe in some of the novelties and some of the things that we put forward for progressive mental health reform. The challenge is we have seen the deterioration and the feedback loops of the primary consumer to the service provider and to the system who makes these policies evaporate. There are certainly some and some decent projects internally. We're talking about a community-based project of a nonprofit that does specifically those 2 things, educates the consumer and helps mentor, train, and engage the consumer in policy activities. And not only are there 60 under the behavioral health state of Oregon, across the state of Oregon, every county has a requirement for consumer voice, every CCO, every major player like Cascadia Central City Concern. This is work that was done 25 years ago, and the outcomes were terrific. So this project has veracity, it has merit, and it has value. Unfortunately, as all the things that we have supported have gotten somewhat confused in why is an outside volunteer nonprofit trying to reshape OHA? And oftentimes it comes with some friction and some challenges. Representative Hayden and Representative Nost were the chief sponsor of HB 2980, the peer respite bill. Governor Kitzhaber sent me to New Hampshire 20 years ago to look at that project. We are almost to the end of the biennium with HB 2980, and they have yet to finalize the awards. There are some challenges. We know that we're having a new leadership at behavioral health coming in, and we're looking forward to that. We think this community-based initiative has veracity and merit, and it gives some spirit and some hope to people who are lost with no cultural, no community, and no connections of each other. And this project deems to support that viewpoint. And there's a bunch of other people who can speak more clearly than I can about this project. So thank you for allowing me to speak today.
Thank you for your testimony. Much appreciated. As you mentioned, we do have a number of other people who've signed up to provide testimony. Commissioner Sharon Myron is joining us remotely. Welcome. Hi, Dr. Myron. If you would introduce yourself for the record.
Oh, yes. Thank you, Chair Patterson, Vice Chair Hayden, and members of the committee. I'm Sharon Myron. I'm a Multnomah County Commissioner, and I also am a practicing emergency room doctor. I am here to testify in strong support of Senate Bill 432 and the -1 amendment. And speaking to what Mr. Fitz described, I have served on innumerable committees and all with the same people, and there are too many reports to quantify, and we need to make progress here. Our counties serve, as you know, as our region's local mental health authorities. We're your partners on the front line responsible for implementing the behavioral health policies that you enact at the state level. And as we all know, we're beyond a crisis point in terms of access and understanding and navigation to a functioning behavioral healthcare system here in Oregon. As a county commissioner, I've seen well-intentioned and extremely well-funded policies fail at the implementation stage because at one extreme, they do not incorporate the expertise of people impacted by the policies in making key decisions. And then at the other extreme, they rely on the input of consumers to the exclusion of all else without providing actual support, technical guidance, or structure. We recently saw this disastrously play out with the rollout of Measure 110. As an ER doctor, I see the impact of failed policies up close, and it translates into astronomical healthcare costs and immeasurable human suffering. People trying to navigate a non-existent system of behavioral healthcare with no support, no understanding of that system, no guidance, and they end up in crisis, often boarding in our ERs for days or even weeks in these windowless rooms because there's nowhere for them to go, and policymakers haven't put together plans that work in the real world. SB 432-1 offers a common sense approach that can have an outsized and dramatic impact in terms of how policies are developed and function in the context of our existing system. At the policy level, involving consumers at the decision-making stage with technical assistance will ensure money, time, and energy isn't wasted passing policies that are destined to fail down the road because they don't meet the needs of the real world and real people. At the individual level, Senate Bill 432-1 will offer a stable, ongoing, and nimble source of support, training, and outreach to over 250,000 Oregonians across our state who need and use behavioral health services. It will enhance recovery and resilience, improve access to effective resources and care, and hopefully translate into thousands less people falling into the non-existent safety net into my ER. I urge you to support SB 432-1. Thank you so much.
Thank you so much, Commissioner Myron. Much appreciated. I do believe we'll be able to get through the rest of the testimony if folks are able to limit their testimony to 2 minutes. I'd like to now call on Barb Rainish, resident of Portland, who's joining us remotely. Is Barb Rainish here, joining us remotely? Let's go on. We'll return. Let's go to Dr. Daniel Fisher from the National Coalition of Mental Health Recovery, Cambridge, Massachusetts, joining us remotely.
Okay. Can you hear me?
Yes, thank you, Dr. Fisher. Welcome. If you would introduce yourself for the record.
Yeah, thank you very much, Chair Patterson. My name is Dr. Daniel Fisher, and I'm Vice Chair of the National Coalition of Mental Health Recovery. I want to emphasize the importance of this bill. I founded and ran for many years a national equivalent of this Technical Assistance Center, the National Empowerment Center, which is founded and run by people with lived experience. This concept of having people lived experience, such as myself, which I went through before I became a psychiatrist, is essential to the development of policies which have meaning in the real world. I was a commissioner in the White House Commission on Mental Health, and in that commission report said, quote, involve consumers and families fully in orienting the mental health system towards recovery. And the report went on, local, state, and federal authorities must encourage consumers and families to participate in planning and evaluating treatment and support services. So this is an initiative on the federal level. I'm writing to encourage you to support the Senate Bill 432-1, this behavioral health consumer-run technical assistance center. What this will do is it will enable people with lived experience who have played a major role in shifting the system from maintenance to recovery. It'll enable us to play a continuing major role in policy formation, in training, and in research. No one knows better, really, what works and what doesn't work than those of us that have received services. So I impart to you all that to have working alternatives such as peer run respites, we must be at the table. Thank you very much.
Thank you so much, Dr. Fisher, for your testimony in support. When we had your name signed up, it had been listed as opposed, but from what I hear, you are in strong support. So thank you very much.
I am in strong support. Thank you.
Thank you. I'd like to now call Dr. Jacek Hasiak, our director from Dynamic Changes, who I believe is here. Thank you.
Yes. Good afternoon. I'm going, first of all, my name is Dr. Jack Hotchuk, and I am the director of Dynamic Changes LLC. What I'd like to do, first of all, I'd like to point out the irony that one of the problems with folks being empowered to speak for themselves is that they are often kind of pushed into very limited opportunities to do so that have very little authority and time to do it. I would like to surrender my time because I find it ironical that we're trying to get people with lived experience speaking right now, and we have insufficient time because of all the time previously being used for other things. I would like to surrender my time and allow the others to speak. Thank you.
Thank you, and thank you for being here. I'm going to return now to someone I had called earlier, who I hope she is available now. Barb Rainish from Portland, joining us remotely.
Senator Patterson, I don't think that she's going to make it today.
Okay, oh, thank you so much. Laura Rose Masaras from Salem is joining us remotely.
Yes, I don't seem to be able to get my camera quite working, but I'll testify verbally if that's okay.
Oh, that would be wonderful.
My name is...
Thank you, welcome.
Thank you. I'm here today testifying in support of Senate Bill 432, the Oregon Behavioral Health Consumer Engagement Act, which should be delivered by peer-run organizations. Thank you, dear Chair Patterson, Vice Chair Hayden, and members of the committee. I feel that one of the things that's so valuable are the feedback loops, things that we've heard other people mention, navigation, knowing what works, having those connections at the community level through peer-run organizations, delivering this. What I see is there's a difference between the people who work at the state, who have lived experience, and the people that are still in the community, who are on the ground, who may not even have access to health benefits, have difficulty accessing behavioral health care, et cetera. We worked really hard to establish and support growth of the Oregon Office of Resilience and Recovery at OHA, which does a lot of work on the inside. They're at tables and discussions that we might not otherwise be at, carrying voice forward. But we also really need, I think, an opportunity such as this at the community level. There's advantages to being able to get things done. Some of the things we've tried to do as a committee, Oregon Consumer Advisory Council, have taken so long to try to accomplish. And, you know, for reasons that I believe if we were doing it at the community level, wouldn't quite take so long. And so I really believe Oregon deserves the best of both worlds, the best that both approaches can offer. Thank you so much. Please consider support of this bill.
Thank you so much, Laura. Much appreciated. Thank you for your testimony. I'd like to now call Karina Bayruns from the Oregon Mental Health Consumers Association, also joining us remotely. Welcome.
Hi, can you hear me?
Yes, thank you.
Okay, it appears I'm not going to be able to make my camera work for this for some reason, but
Sorry.
anyway, if you can hear me.
From time to time, Teams gives us quite a challenge. My apologies. Welcome.
Thank you. Hello, my name is Karina Bayruns, and I'm here to urge you to support Senate Bill 432 with Amendment 1. I am on my lunch break right now for my full-time day job, but during my nights and free time, I volunteer on the board of the Oregon Mental Health Consumers Association. I'm working remotely from home today, but when I go to my day job office in downtown Portland, Oregon, I can tell you that it's really obvious to me and probably everyone else around me that current behavioral health services in Oregon are not meeting people's needs. One missing piece is that we need to be hearing from a lot more customers or consumers of the public mental health and addiction services during the proactive service planning and policy stages. And we need to be helping them with their self-advocacy needs. The Consumer Technical Assistance Center that this bill would establish is the extra bridge needed to support people who aren't getting their needs met to make their voices heard. This center will help consumers using public mental health services know how to express their concerns in productive ways during the times when they can make a difference instead of just telling off their overworked clinicians or turning their back on services completely. Self-advocacy and systems advocacy skills can be taught even to people with challenges, and this Technical Assistance Center would do just that. I have worked for a national consumer technical assistance center that was based in Pennsylvania. So I've seen with my own eyes how self-advocacy and systems advocacy skills can be taught to people with a very wide range of background and skills and disability levels. This TA center would also provide resources to consumer-run service providers too, which is pretty much the norm for a consumer technical assistance center. And it's all about bureaucracy guidance, and we need a lot more of that in Oregon in order to get people the help that they need. Thank you for hearing about this bill and making time to discuss this.
Thank you so much, Karina, for your testimony. Much appreciated. I would like to now call on Stefan Scheer from CARE Oregon. Oh, welcome.
All right, Chair Patterson, Vice Chair Hayden, and members of the committee. For the record, my name is Stefan Scheer, and I'm with CARE Oregon. CARE Oregon is a community nonprofit organization serving Oregon Health Plan members for nearly 30 years, and we currently manage OHP benefits for over 500,000 OHP beneficiaries through ownership of 2 CCOs, Jackson Care Connect and Columbia Pacific CCO, as well as being a founding partner of HealthShare of Oregon. I'm going to try to keep my remarks brief as we're pressed for time. We'll point you towards testimony on OLIS, but we strongly support SB 432 and the -1 because we believe it is a positive step towards transforming our behavioral health system and improving health equity. This is because to improve the behavioral health system and services for OHP members, it's critical that the people who are experiencing them are helping design and inform policy. And we believe the center will support them getting involved in system improvement and policy and will advance the peer-run organizations as well. So thank you for your time, and thank you, Senator Hayden, for bringing this bill forward. A bill that also has support from hospitals, CMHPs, counties, CCOs, and as well as advocates. So appreciate your time.
Thank you very much. Much appreciated. I'd like to call on Sunny Briscoe from Damascus, joining us remotely.
Hello. My name is Sunny Briscoe. Thank you, Chair Patterson and committee members, for listening to my testimony today. I am speaking in support of Senate Bill 432 with support to the -1 amendment. I formerly worked as the Deputy Director for the Mental Health and Addiction Association of Oregon for 8 years, and MHAO for short held a grant through SAMHSA for a technical assistance center for 10 years. During that time, I was able to see firsthand the benefits of having a technical assistance center, especially in support of underrepresented communities. We supported underrepresented communities throughout the state of Oregon, as well as West Coast states, including Alaska and Hawaii and some territories in the Pacific. In short, I think this bill would really benefit the residents of Oregon statewide in providing some advocacy support that is not in existence right now when it comes to the community-based organizations that are working boots on the ground in support of peer support and the communities served through those services. One example I would say is not only with the Office of Recovery and Resilience, and they're doing the best they can with the resources and the manpower that they have, but also through the Office of Equity and Inclusion, who runs the Traditional Health Worker Program and certifies peer support specialists and peer wellness specialists throughout the state of Oregon. So in short, I really adamantly support this bill and moving forward. Thank you.
Thank you so much, Sunny, for your testimony. Much appreciated. And we have one more person signed up to speak to this bill, Robert Drake Eubank from R. Drake Consulting in Eugene, joining us remotely. Welcome.
Can you hear me? And does my camera work?
Yes, we can see you too. Yes. Uh-huh.
I have a complete set. I'm going to try to race through this because I have recently received a missive from the state's OHA governmental representative that expressed some concerns that I think the committee needs to know are a little bit skewed and uninformed. I'm actually the chair of the Consumer Council for the state, and I'm not appearing on that in that regard, but I need to let you guys know there's some stuff that's inaccurate in the letter that they sent you about their concerns. This has nothing to do with the federal block grant. It has no fiscal impact. You're welcome to have that examined at the legislative level, of course, but many of the concerns that are expressed are from somebody that's relatively new and does not has not had any conversations with me, even though he mentions my organization within the state council. So anyways, being given, there's been a frequent refrain in the critical care system of the state that we don't have enough providers, there's not enough community supports, there's no place for persons in the hospital to exit to. There's no community for the consumers that exit the hospital except those that are in clinics and are official without having any kind of real human contacts to go to. And this opportunity, which would be heavily supported by the terms of this bill in terms of community support for people forming drop-in centers, other community networks of peers that would essentially provide supports and other informational and technical assistance. We had a robust system in the late 90s and early 2000s that went away with the budget, and hopefully finish up in 20 seconds. The cost for those supports, they spend $40 to $50 million each year for the hospital in Junction City. This is less than $1 million, and they will serve more people than both hospitals combined, just right off the bat. So I put in a council resolution in my written testimony that was done in October of last year. I just want to say that includes strong support for the ecosystem of consumers that this would actually be a significant, have a significant impact with. So thank you for your time.
Thank you for your testimony and for bringing that information. It was very helpful. Thank you so much. And we have 2 minutes left. We'd like to return. Would you like an opportunity? You yielded your time. We'd certainly like to invite you back, Dr. Hasiak.
I'll put in my little 2 cents worth here. Again, I'm Dr. Jack Hotchuk, the director of Dynamic Changes LLC. I'm a retired psychologist. Let me do a little reading here. Retired psychologist, having served over 40 years as administrator of mental health programs and a clinical services provider in 5 states, including being the mental health director of Linn County Mental Health Services here in Oregon. I support this bill strongly. Let me just try to make this succinct. Typically, individuals with lived experience are segregated, their input diminished by putting them into what ends up being token roles, either on a main decision-making group. There may be one individual, and quite often, unintentionally, stigma still operates to have members of those decision-making groups view the individual's views as less important, less informed from a system perspective, or they are then relegated to advisory boards, councils that are secondary to the main decision-making process. And often I have seen happen where the decision-making group decides to move ahead on the decision, then goes to the advisory groups and say, what do you think? Rather than them being directly involved. And if in fact the individuals say, well, we disagree with some of that, they go, oh my gosh, there's not really enough time for us to be able to go back now and really take your input here. Next year, when this comes up again, then we'll take a look at that. And these things continue to be sidelined, minimized, individuals involved feeling devalued as they should. So this particular bill looks to rectify some of that, and I have provided Senator Patterson with some documents that I'd make available to others about recent policy briefs at the national level, pointing out the importance of individuals with lived experience being given authoritative roles, meaningful roles in central decision-making processes. That is incredibly important for the system to actually start to provide services that heal rather than services that are system efficient. Thank you.
Thank you so much for your testimony, and thanks for your patience. Committee, are there any questions or comments before we?
I just want to say a brief comment. Thank you, Chair Patterson. So here's the concept. We know that our mental behavioral health system is very fractured. Mm-hmm. We have the CCOs, we have all the counties, we have 60 some, it went from 40 when I started here to about 60 different organizations or task force or commissions or whatever to deal with this. But there's not one place for these organizations to go to say, hey, I need help. Think of a school-based program or a school that wants to apply for federal aid or a federal grant. They have grant writers. Mm-hmm. They have technical assistants. So we're trying to set up something that is a central point for these organizations to go to and get to assistance to work through the process, right? Think of a peer person, somebody lived experience, has come from the street. It's not reasonable for us to expect that they can work through this litany of bureaucracy without some assistance. And my hope is that we move forward with this bill and create that technical assistance center, and then we don't have a need for 40 to 60 different entities discussing the issue, but have it centralized and tone that back down to a more reasonable, effective amount of people that are working on the issue with tangible results.
Well, thank you so much for bringing. Thank you so much for bringing this bill, and that explanation. And thank you to all who testified. We're going to go ahead and close the public hearing on Senate Bill 432. And Mr. Dietz, could you give us an overview of what's coming next Monday?
Yes. On March 6th, the committee will be back. We do have the members of the public, members may have seen previously, posted work sessions on Senate Bill 404. That's the chair's bill related to prescription drugs. Senate Bill 704 related to universal health care. We anticipate an agenda will go out later today that will have those listed with scheduled work sessions. We also have a couple of measures being brought to us at the request of Senator Gelser-Bluin, along with including a requested public hearing by Senator Gelser-Bluin and Secretary of State related to prescription drug monitoring program and veterinary care. So we have a full agenda, including work sessions and public hearings on Monday the 6th. Agenda should be out shortly.
And hopefully by then it will be closer to spring.
Let's hope.
Our meeting is adjourned. Thank you, everyone.